Capitalism is a powerful economic system that has brought unprecedented wealth and prosperity to the world. But when applied to healthcare, the results can be problematic to say the least. Capitalism in healthcare has the potential to promote greed and inequality, leading to an unfair distribution of resources and a disconnect between those who can afford quality healthcare and those who cannot. This has a profound impact on individuals, families, and communities. And it is important to explore this issue in order to develop solutions that can promote health equality. I will examine how capitalism in healthcare has led to greed and inequality, how it has impacted individuals, and how we can work to create a more equitable system. What's up, guys? So what's been on my mind today? Healthcare. Okay, let's get into this. So what is capitalism? Capitalism is an economic system where goods and services are traded for money, and investment in businesses to create profit is facilitated by a country's government. Capitalism is not a specific type of economic system, but rather, it is a general term used to describe a variety of systems that use capitalism as the economic model. There are different types of capitalism, and each has its own strengths and weaknesses. For example, the free market capitalism found in the United States relies heavily on profits, incentives, and competition, while mixed capitalism in the UK uses government regulations to create a balance between capitalism and socialism. So I know you're asking yourself, how does capitalism promote greed and inequality in healthcare? Healthcare has been considered a public good that is essential for human survival, and therefore should be available for all people. Historically, healthcare was provided through a variety of different systems. In the United States, it was provided mostly through the public sector, paid for by taxes and health insurance. In many other countries, healthcare is provided through a combination of public and private sector providers. Since its inception, capitalism has prioritized profits above all else. With the rise of high deductible health plans and private for-profit health insurance, capitalism has played a larger role in healthcare, leading to an increased focus on greed and profits in healthcare systems. In addition to healthcare costs, insurance providers also set their premiums and out-of-pocket costs as high as possible, meaning many people are unable to afford care, even if it's available to them. Now, what is the impact of capitalism in healthcare on individuals? Due to its high cost, many people avoid or delay necessary medical services. This can lead to poor health outcomes and a reduced quality of life for many people. People living in poverty are disproportionately impacted, as many cannot afford insurance or the out-of-pocket costs associated with care, even if it's available to them. People living in poverty often have limited access to healthcare services, including preventive care. Research has shown that people living in poverty are more likely to suffer from chronic conditions, such as heart disease, and less likely to receive appropriate care. People who can't afford health care are often able to access the latest technology and state-of-the-art care. This has led to growing gaps between rich and poor. Many medical professionals and researchers have expressed concern that this will lead to an even greater health disparity in the future. Okay, so what is the impact on families when it comes to capitalism and healthcare? The cost of healthcare is often a source of stress and worry for families. Many families are unable to afford health insurance, and those that do often face eye-popping out-of-pocket costs and high premiums. This can make it difficult for families to access care for both themselves and their loved ones. Families with low income or without access to insurance face an even higher level of difficulty in accessing care. Additionally, families often have to make difficult choices in terms of which family member receives care. This can leave loved ones without proper health care access and overall poor health. Believe it or not, communities are impacted in some of the same ways that families are impacted. It is important to note that many communities are composed of individuals who are impacted by these systems. In addition, impacted communities also see an increased health disparity between people with the means to access health and those without access to health. Health disparities on a local level lead to poor health outcomes for people of the community, and it can cause huge financial burden on a city's health system. It would be irresponsible to just degrade capitalism in healthcare without coming up with solutions. There are a number of strategies we can use to create a more equitable healthcare system. The first is to promote universal healthcare coverage, which means extending coverages to all people in a given society, regardless of their income. Another important strategy is to focus on providing high-quality, comprehensive preventive care to all people. Preventive care helps to reduce the incidence of chronic condition early on, which reduces the overall cost of care. Finally, we can work toward improving the health of low-income populations and communities by providing education, resources, and support for positive health and wellness. Now, here are some examples of what has worked. There are a number of examples of what has worked in creating a more equitable healthcare system, including socialized healthcare, a single-payer healthcare, increased public coverage, prevention and wellness, and a strong focus on equality, as well as community and individual resilience. Socialized healthcare works to reduce the financial burden of healthcare costs on families and individuals, making it more affordable for people across the board. Additionally, it promotes equity by expanding coverage to all people, regardless of their income. Single-payer healthcare works to reduce inequality by combining private and public insurance. This allows people to receive affordable coverage, regardless of their income level. It also promotes equity by extending coverage to all people, regardless of their income level. Capitalism in healthcare can promote greed, increase health disparities, and lead to an inequitable distribution of resources. The good news is, healthcare systems don't have to be structured this way. We can work toward a more equitable system of healthcare that promotes the health of all people, regardless of their income. Okay, guys. So that's what's been on my mind today. You guys have a good day. Peace out.